Right, there we go. Okay, good afternoon, everyone. It's good to be with you here at City Hall. I want to, the mayor is here, I know, Mayor Provenzano. Thank you, and staff that are here as well. I want to welcome a couple of individuals who you are familiar with. First to my immediate left, Dr. Eric Hoskins, who is our Minister of Health and Long-Term Care. He's also the MPP for the riding of St. Paul's. And I want to thank him for coming to Sault Ste. Marie today and for his expeditious action on this issue. I want to also recognize Graham Scott, who is here. It is his report that is the subject of today's conversation. I want to thank him personally for his thoroughness and his insightful analysis of the issues that faced Algoma Public Health. We're going to hear a little bit more about that in a few minutes, but Graham is the former Deputy Minister of Health for the province and is an incredibly capable individual. So I want to thank you very much for taking the time and the work that you did to put the report together, and again as well for being here in Sault Ste. Marie. All I will say at the onset, folks, is that the significant level of public concern that was raised with me at our office with respect to the operations, the governance, issues around transparency and accountability, quite frankly, at Algoma Public Health, were brought to me by employees, they were brought to me by citizens in the community, and became very significant. Issues that were made known to council as well became apparent, and I certainly believed, and I believe you will certainly, based on the report and the findings, understand that it was certainly my obligation and my duty and responsibility to our community to ensure that all of the matters that were raised and were in question around the operation of Algoma Public Health were brought to light. And that meant contacting our Minister of Health, Dr. Eric Hoskins, and then subsequently the ministry determining that it was appropriate to bring an assessor in to do an independent third-party evaluation that was independent of the ministry itself and independent of our government, and that's what's taken place. And so, I certainly, it was impressed upon me by individuals who I spoke to, many individuals who I spoke to in our community who were involved in Algoma Public Health, that they had very, very real concerns and had made some significant and serious allegations around the operational issues at Algoma Public Health. And that's what brings us here today. So I'll leave it at that, and I'm going to turn things over to Minister Hoskins. Thank you.
Well, good afternoon, everyone, and thank you, David, for that introduction. Thank you for being, as well, such a strong advocate for this community. And you're correct in that your hard work and that of others in the community are really what, in large part, bring us to this moment today. It's certainly the case in Queen's Park, and I suspect it is here when there's an issue that needs to get done or response or action required. There's pretty well nothing that will stop David from making sure it gets done. And I believe that your commitment to your constituents and your tenacity, quite frankly, in getting action and seeing a solution is one of your greatest assets, and it is truly one of the reasons why we're here today. Ladies and gentlemen, earlier this year, as a result of what was growing concern with regards to the governance and operations of the Board of Health for the District of Algoma Health Unit, I appointed Mr. Graham Scott to conduct an assessment. And thank you, Graham, Mr. Scott, for joining us here today. I asked him at that time to assess the quality of the management and administration of the affairs of the Board of Health, and to determine whether the board was complying in all other respects with the Health Protection and Promotion Act. And in his assessment, Mr. Scott found that the Board of Health for the District of Algoma Health Unit failed to meet its obligations under the Act, which has had a negative impact on the operations of both the Board of Health and the District of Algoma Health Unit. Specifically, the Algoma Board of Health failed to ensure the quality of administration and management of its affairs, and also failed to meet governance expectations in accordance with the Public Health Funding and Accountability Agreement and the Ontario Public Health Standards. Mr. Scott's report included 3 important recommendations, among others. 1, all members of the Board of Health for the District of Algoma Health Unit, except those members who were appointed for the first time following the municipal elections in 2014, should step down voluntarily or be removed by the municipalities in the province. Mr. Scott also stated that this is essential to provide a needed fresh start for the organization. And number 2, the Board of Health should be a skills-based board. And the 3rd recommendation, municipalities should look carefully at the advantage of appointing members other than municipal council members on the Board of Health, given the demanding work burden of elected councillors. I take Mr. Scott's report and recommendations very seriously, so we will be taking speedy action. Earlier today, I asked for the immediate and voluntary resignation of municipal and provincial members who sat on the Board of Health prior to the 2014 municipal election. My ministry will also undertake a review of the Board of Health for the District of Algoma Health Unit's current governance structure, which will include working with municipalities within the District of Algoma to ensure board members who are appointed have the necessary and appropriate skills to exercise and ensure appropriate governance and accountability. We will also be hiring a governance consultant to work with the municipalities within the District of Algoma to assist with the appointment process. My ministry will be working with the Board of Health in the recruitment and appointment of a full-time medical officer of health. And once appointed, the ministry will support that person in fulfilling her or his duties under the Health Protection and Promotion Act. And in order to ensure that there is more of a focus on effective board governance practices for nonprofit organizations, the ministry will continue to work with the Association of Local Public Health Agencies to enhance Board of Health member orientation practices and processes. The ministry will require the Board of Health to attest that they are in compliance with the requirements as set out in the Ontario Public Health Organizational Standards. These standards include specific requirements around orientation and training of Board of Health members, Board of Health self-evaluation, leadership, and trusteeship. And furthermore, the ministry will provide additional tools to support the Board of Health's ability to assess and determine risk and meet accountability requirements established by the ministry. And finally, the ministry will continue to conduct regular follow-up audits of the Board of Health to ensure compliance with requirements related to financial, operational, and value for money aspects of transfer payment funding. Ladies and gentlemen, the public health of local residents is paramount. We want to ensure that the Board of Health is performing its duties and responsibilities effectively and efficiently. And by putting rigorous measures in place to address the shortfalls of governance and oversight by the District of Algoma Health Unit, we will ensure accountability for the expenditure of public funds. Now, before we go to questions, I just want to acknowledge and thank the frontline staff at Algoma Public Health. They've worked extremely hard to provide vital services during such difficult and troubling times. And I want to thank them for putting the people in the communities they serve first. They show tremendous dedication each and every day. And thanks to Mr. Scott's valuable advice, we now have a plan to build a stronger organization that not only provides valuable health services to the public, but is also accountable to the public that it serves. It's time to make a fresh start and move forward together. Thank you very much. And perhaps I'll ask my two colleagues to join me, and we'd be happy to take any questions that you might have. If there are any. Or if that's a preference to just have a pull aside, we could do that too. Okay? All right. Thank you, everybody. Thank you. There'll be questions, but I want to grab each one of us individually.
Maybe we just do this individually.
Yeah, well, I
Or
figure
individually,
there's
yeah.
enough of us that, David, I'll grab you first.
I'll grab you first.
I'm Elaine Delmatier from SooToday. I'm Elaine Delmatier from SooToday. Nice to meet you. No, I've been tweeting along the way.
Yeah, it's
Well, I think that in addition to audits, I indicated today that we're going to be providing significant support to both the board and the public health unit. On the public health unit side, to work with them to find and appoint a new medical officer of health, which is critically important to effectively serving the members of this community. On the side of the Board of Health as well, we'll be working closely with our municipal partners because it is a joint process, and there are municipal appointees as well as provincial appointees to the Board of Health here in Algoma, and we will be working closely with our municipal partners to ensure that those who are appointed are truly skilled-based, that are able to contribute to the governance and administration of the board, and that they will be fully trained and capable of understanding what their duties are and being able to effectively fulfill those duties.
Could this be described, this situation, as a breach of trust to those who look out to Algoma Public Health as a trustworthy agency given what has happened?
Well, I think importantly, Graham Scott, the assessor that I appointed and asked to look at the management and administration of the board, and are they fulfilling their duties according to the law and the various acts that apply to them, he determined that they were not, that the level of governance and accountability required to fulfill their duties under the Act was not complied with. Hence his recommendations for asking for the resignation of those who were appointed prior to the last municipal elections. I'm following through on his recommendations, that one, but all of his recommendations.
Can you give us an example of a sort of a similar situation and what the expectations are?
Well, I think...
What you would like to see happen as a result of the changes that?
Well, I think the lessons learned here in Algoma provide us with the opportunity to strengthen the governance, oversight, accountability across the province. It happens to coincide with a review that I've asked previously, before this issue came to fore, asked my ministry to look across the province at our public health units to ensure that they are providing maximum support for the population they serve, as well as value for money, and that they're achieving the outcomes that we expect. So I have no doubt that the information that we've obtained as a result of what's happened here in Algoma will prove useful to that process.
How soon will the first audit be, or the first follow-up?
Well, I'm not sure. I'll leave that to the ministry in terms of we have just completed a financial audit, but it will be more than subsequent financial audits. It will be looking at the operations, the governance issues again of the board to ensure that they're complying with the Act.
Minister, can you talk to us specifically about the shortcomings? What did Mr. Scott find that was concerning to you?
Well, I'll let him speak to the specifics, but his finding was that they were not in compliance with their obligations under the Health Promotion and Protection Act, HPPA, Health. I just want to make sure I've got that. I think it is Health Protection and Promotion Act. Let me start again. So, Mr. Scott, I'll let Mr. Scott speak to the specifics of what he found, but he determined that the board itself, I asked him to look at the management and administration of the board. I asked him to look to see if they were in compliance with the legislation with regards to governance and accountability. He determined that they were not in compliance, that they were not meeting the expectations that Ontarians, let alone the government, should have of them with regards to management and administration and oversight. And on the issue of governance as well, they were not in compliance with the Act that they are required to follow.
And it would have to be, I assume, pretty serious, not just a technical infraction for you to take action as serious as you have today?
Well, I think by my act today to call for the voluntary resignation of the board, all those who were appointed prior to the last municipal election in the fall of 2014, I think you would agree that that is a pretty serious step to take. It responds to very serious findings. All right. Thanks. Thanks, guys.
Could you continue to hold this?
Yeah. Do you want to join me on some of the, just follow me around?
So, how are we doing?
Not too bad.
Who's this guy? How you doing?
You know Drew?
Good. I do now.
Local too. Yeah, sorry.
I do. Nice to see you.
Likewise.
How you been?
Good. So what, how serious do you think this was? Are you, we have not so far been advised of what particularly Mr. Scott found. How serious was it? I do have it here, yes. Haven't had a chance to
Go
look.
through it and determine for yourself, the issues that were present. I think the concerns that were brought to me around the sharing of information, around the involvement with the marijuana, initiative that members of the organization were part of, and that the board at large was not aware of. Mr. Scott raises issues around transparency, issues around conflict of interest, and I think if you take a look at the report and read through it, you'll see that there's a level of seriousness to the concerns, and that if we're going to have the trust and confidence of the organization in the community, there needs to be greater transparency, greater accountability in the organization. So he's made reference to, in fact, going so far as to amalgamate the organization with the Sudbury Public Health. In other words, dismantle it in the sense of, the highest level of the board and roll it into the Sudbury Health Unit. That to me is, punishing the community for the actions of a few. And so the minister and I are of the mind that we want to see the board restructured. We want to see the organization, renewed. And we want to work toward that goal in seeing that happen, and we believe that will help to rebuild the confidence, as well as following through on the other recommendations that are part of the Scott report. Governance and training, the skills-based board, finding individuals who meet certain requirements or skill sets. He's identified those in the report as well. Will make for greater accountability of the board, greater understanding of the programs, the requirements in terms of what needs to be delivered to the public. I have to say as well, and I would certainly echo those comments, that there are many fantastic employees at Algoma Public Health, and they have been doing a great job in the community delivering these programs under some pretty challenging circumstances. A lot of uncertainty, a lot of skepticism, a lot of concern around what the leadership was involved in or not involved in, and it was really that unknown that was really creating much of the concern. But there are allegations that were brought forward that were substantiated, and that Mr. Scott has determined were in fact problematic. There's 36 health units in the province of Ontario. If we want to keep this health unit in Ontario, in Sault Ste. Marie, with the governance and the structure that it has, then it really needs to run more efficiently and more effectively like many of the other health units in Ontario, or it won't be around it will be around in the sense of public health programs in the community, and they'll be delivered by the staff that are here. But in terms of that governance and the board and the level of administration, in terms of management, that is obviously a huge question mark, given what took place with Mr. Holmes, the previous financial officer, and the previous organization over a lengthy period where people thought there was accountability, they thought there was transparency, but apparently over $400,000 of taxpayers' resources were not going to people in the community who programs, and that costs the community, and that's not right. So coming on the heels of that, you would think that the new administration and the new organization being formed would have been more attentive to governance issues, to transparency issues, to greater involvement and accountability. The process by which the individual was hired was completely unacceptable, and Mr. Scott highlights that as well. And Mr. Scott also refers to the fact that given the previous circumstances in the health unit that the community was well aware of, it was surprising that there was a real lack of concern and involvement in making sure that coming off of that and coming out of that, the organization wouldn't have been better run. And we find ourselves in a similar situation in terms of questions around governance and transparency and resources. He also refers to resources being used for the marijuana project that were dedicated public health resources. So the ministry is now reviewing the financial audit, and that process, they're going through those recommendations, and we'll probably have more to say in the not too distant future on that element of what took place here at the health unit.
Now, do you think there's a lesson here for people serving on boards and commissions in terms of diligence? Because often we see people show up, some of them are very diligent. They'll sit there with copies of Robert's Rules of Order and things like that.
Right.
And some of them don't even read the agenda. You've been involved in local politics. You know how it works. Is there a lesson here that people need to take home from this?
Absolutely. Absolutely, David. That needs to be an important part of the process of new individuals coming on boards. It's great that we have citizens who are well-meaning and committed to their communities who put their hand up and say, I want to be involved in this board. And that's a big part of the process, because after all, these are voluntary boards. But we also want individuals that have appropriate skill sets for specific functions and specific types of boards. And it's really important that they take the time to be familiar with the organization that they're responsible for and that they're overseeing, and that they do attend the meetings regularly and read their agendas and are familiar with the material that's being debated and ask the right questions. Ask the questions that need to be asked, because that's the only way they will know as a board member whether or not the money that they're spending or the person that they're hiring or the property that they're buying is exactly what they intend to have happen, or is the outcome that they're looking for. So it is a very important lesson. Unfortunately, we've seen it too many times in across the province in different organizations and at different levels of government, and you name it. Board governance is a challenging issue, and it's one of the reasons why we're facing the circumstances we're facing. You're also familiar that Mr. Scott did a review of the Parry Sound Health Unit a number of years ago, and that health unit was basically divided in half, and the governance structure eliminated. It was brought into the North Bay Health Unit and the Nipissing area, and the Parry Sound, the Muskoka Health Unit absorbed the other portion of that. So, there are problems, with board governance in various organizations. No organization is immune from these types of challenges, and it does take, consistent vigilance from board members to make sure that they keep the organization on track.
We just raised the bar?
We're raising the bar. Absolutely, we're raising the bar. Raising the standard. I think organizations where individuals participate on boards are becoming more aware of their responsibilities and their obligations as board members.
Okay.
Yeah.
Thank you.
Thanks, David. Okay.
Sorry? Okay. Are we live streaming, by the way? Yep. Okay. We'll catch the mayor there if we can.
Oh, sure. Sure. I did. Just when she was getting off the elevator.
Okay. So, Mayor Provenzano, you were supposed to go tomorrow night.
Yeah, I was.
To Algoma Public Health, to their board, to address them about your concerns. Where is that now?
Well, I haven't read the report yet in full, so I'm not sure to the extent that the questions that we've had have been answered. Obviously, if the questions are answered, I won't belabor any point, but if I still see value in attending, I'm happy to attend. I've advised Dr. Sutcliffe that I'm happy to attend. So they've asked me to give them the day to consider the matter. They're not sure how their board will react or what the board will look like tomorrow. So I told them to take that time and to give me a call tomorrow, and I'm happy to talk to them about that. So I'm still willing to attend. I'm happy to attend. I think that there could be some value in it, but I need to read the report myself, and then I think the people at APH need to assess it for themselves, and we can make a decision. But on this point, I think I want to acknowledge that the staff at APH are a really important constituency in our community, and they're working hard to deliver public health services, and they're very valuable. And I have no doubt that the municipality values them, and I have no doubt that the senior management at APH values them. So that's the commonality we have in the core concerns. So we're going to talk in the next few days how best we could make sure that the staff there recognizes that we want to work together. We want to make sure they have good governance, and we want to make sure that we recognize the important contribution they make to our community.
So we are weeding out the presumed dead wood from this board, using the word carefully, but the local board is still being allowed to continue. The province could have come in and just taken over. Is this a good thing for local government?
Well, look, frankly, yeah, the province, I think, has the authority to have dissolved the board if it so chose, but it didn't. And it's asked for the voluntary resignation of members that were members prior to the December 2014 election. And we'll have to take a step back and see what those folks decide to do with that request. I respect Minister Hoskins, frankly, for respecting the jurisdiction of, self-governance and local government to make some decisions. But he's made the Ministry of Health's position pretty clear. So we have to take a step back here. We have to see what the directors who are affected by this decide to do. or the members of the Board of Health that are affected by this decide to do, and then we'll have to make our decisions subsequent to those.
Okay, and there's lots of other boards and committees in this community with varying levels of diligence. Is there a lesson here that members of those groups should be taking home?
Well, frankly, I think there's a governance lesson here, and that not only for the Board of Health, but for a lot of the people that participate in governance of different agencies, you have a responsibility, and you have a responsibility to be very active in your oversight. Governance matters, and boards and committees matter, and ultimately you're responsible. And we see that at City Council. Like, the City Council is responsible for what happens in City Hall, and we exercise that responsibility by meeting regularly, and by being diligent, and by pressing, and by asking questions, and by making sure the policies and procedures are followed, and by making sure we have the right policies and procedures in place. Governance isn't easy, and a lot of these positions are volunteer positions. So we have to make sure that we equip our volunteer directors and our volunteer members with the right skill sets to do the job well. So that's a takeaway for me, and that's a takeaway for the city. We have to make sure that people that we appoint to these agencies have the right skill sets to lead properly and to govern properly.
Okay, thanks, Mayor Provenzano, and we'll see you tomorrow night, maybe.
If it's going ahead, we'll probably see each other.
Thank you.
Take care.
Where to, man?
Mr. Scott next. We're still live streaming?
Yep.
Okay.